So basically, if you can see there, first of all, in terms of grammar, there are some general rule for grammar for salutation. Like this is the first thing, like how to write down the address. So like this is the format to write down. If you have the name of the doctor, we write down the second name. This dot is optional. You can write or you can omit. It's your call. If you don't have the name of the person, you can write down sir or madam. And if not sir, madam, we have the designation given, such as cardiologist. You can write down dear cardiologist or maybe uh, dear registrar if the name is not being given. That is followed by the subject line. We should write down regarding patient name. And we can also write down Mr. with that, or Mr. can be written over here. Then we can put comma as well. We can write down date of birth or age, whatever is given, right? Anyhow, then we have introduction part. In the introduction, though we have discussed, first of all, we can write down the name, age, occupation, marital status, gender, if it's relevant. A brief summary of purpose of writing and chief complaint can be written in the introduction, right? Simple thing. So inside the structure of the writing, there are two things that are important beside the basic structure, like I'm writing to refer or thank you for seeing, both are acceptable. The positive noun that do describe the further quality of the noun. We can write down the age of the patient if we have not written over here, right? And we can write down the example profession of the patient or anything such as an overweight person can be written over here if it's important and significant, right? So we can write down over here and we have to put comma after the patient name. We should write down the second name of the patient, or maybe we can also write down the full name of the patient over here, at least in the introduction, right? After that, we can see there, it's better to write second name because we have written the first name over here already in full name. So we can write it down the second name better too. But we can write full name in the introduction part is fine. Then the positive noun, the second component of the grammar that you can show writing the age or the profession if it's important, or any quality of the patient if it's important. The third step is your relative clause, which is defining and non-defining clause. So as you can see, relative clause that start from who, with, he, she, it, and that can relate to the previous statement. It's a relative clause by concept. So if we have a relative clause and we are starting a clause from this sentence, right? And if we can put full stop after completing this clause, who presented with signs and symptoms suggestive of Alzheimer disease, full stop, right? So we can see that there is no comma, but when we are writing the same sentence, forget about the first part of the sentence. When we are writing the same sentence, whose sign and symptom are suggestive of Alzheimer's disease for further management, it's a non-defining clause. Non-defining mean like if I can omit this whose clause from the sentence, the sentence will be complete grammatically, obviously, not meaning wise. So we have to put comma over here and after accountant and after disease. So for to make it more easy for you, just remember, if you are writing in this format, completing a sentence over here, not continuing further, do not put comma. But if you're writing in this format, you have to put comma in the sentence. Sometime you can see that there is some non-relevant line written, specifically when we are referring the patient through channel. Mean that if you're writing this letter to the, let's say, uh, gynecologist, but through emergency department. So at time it happened that you have discussed with the gynecologist and she want you to, it's an emergency, you need to book your appointment to emergency. So we can see, or as discussed with you over telephone, I am referring this patient through emergency department to your clinic or to your hospital. Or if you have discussed with the receptionist, we can discuss the start the statement in over here in this manner. As discussed with your receptionist, I'm referring like that. So at time, these statements are important. If in case, if it's a channel referral mean it's not a direct referral. You may have discussed with the receptionist. First of all, you may have discussed with the gynae registrar or any other doctor, cardiologist, for example. They want you to refer through emergency department to their clinic. that is inside the hospital, but they want you to refer to channel. So we can use this line. And you must have politeness throughout your letter, specifically in the conclusion part. And in conclusion, what we have is the reason of referral, important. We could also have the polite request, that is important. And the, we can say, ongoing support can be written in the conclusion. We already have discussed that thing in the previous lecture. So be specific in the introduction part, which tense would be more appropriate when we have to write down the introduction. First of all, in the introduction part, we have to write it down, let's say past simple or present simple as per importance space. If we are writing a letter and you believe that we have to write it down maybe present or past simple, depends. For example, I'm writing to refer Mr. Mark, whose sign and symptom are suggestive of diabetes mellitus. Now, this is your present simple tense. But at time, we can see that we can write down present perfect tense in the referral letter even, who has been unresponsive to the treatment of, let's say, blah, blah, who has been having uncontrolled blood sugar level, let's say, or who has been having worsening of blah and blah. So we can see, you can see that you have to add on these things over here in the introduction part, different tenses, right? So we can use the present simple tense, present perfect tense, and perfect continuous tense most of the time in your referral introduction. However, we can also use the past simple tense, as you can see in the third sentence, who presented today with a severe chest pain and heavy wheeze, for example. I'm referring this patient for a definitive diagnosis. Then we also have a discharge letter. Similarly, for discharge of letter, we simply use most of the time past simple and present perfect, right? We simply use most of the time past simple and present perfect, right? So generally speaking, who underwent, let's say, or who has responded, or who has been responding to the treatment of schizophrenia, right? These are the general statement. Now we can see the tenses when you write down the social history or the past medical history paragraph. Now present simple tense, we have habits and hobbies. These are the present simple. We use the, let's say, smoker, drinker, diabetes, sedentary lifestyle, whatever it is. If it is without time frame, there is no time frame being mentioned, we can just use the present simple tense. Let's say he's a smoker, or he smokes, or he drinks. He is living a sedentary lifestyle. He does not do an exercise, let's say, like that. Or maybe the family history, he has a positive family history of diabetes. It can be written in the present simple tense. Now, present perfect continuous tense, it's your, he's a smoker. Let's say, if you can see there's a time frame mentioned. So we can use that he has been smoking for the last 10 years, or he has been having diabetes since 2010, or he has had diabetes since 2010, right? If we have time frame mentioned, we can use the present perfect tense. Then we have past simple tense. In case if we have past simple or past perfect tense, we have a past surgical history we can use, but it's quite rarely to be seen in your social plus parliament history. But yes, we can write it down. She underwent appendectomy, or she had an appendectomy in 2012, followed by blah and blah thing. So now we can see that if you have to write it down, the social history, at least we are somehow sure that which tends to be written in the social plus past medical history paragraph. Okay. That is followed by the treatment record, ward or rehabilitation. Now, in term of treatment record or ward or rehabilitation, minus today visit, we can completely write it down, those paragraph in referral or in discharge letter in simply, we can say past simple tense most of the time. If we are writing the treatment record, or if we are writing the ward stay or rehab independently. Here are a few examples. Let's say, initially on this date, Mr. Andrew visited with the complaints of mild abdominal pain. I've started with the past simple tense. He had 2 episodes 10 days back low. From this visit, let's say, maybe on the 20th or 21st of the, let's say, August, patient had this pain. So that's why I'm using, he had 2 episodes 10 days back and even a day before. So I'm using the had with that to differentiate this visit from the 10 days back history, right? So we have to differentiate 2 events in the past we can use past simple and past perfect together if we have to differentiate two events in the past. Okay, now we can see the another example. We have to see over a period of 3 weeks, Mr. Alex had visited us three times with mild existing chest pain. Now we are composing, let's say, all those three visits that is in repetition. When we have repetition, we can use our for that. That our repetition mean like the patient came to you for 3 times, and at the moment, let's say we have a severe pain. So that's why we were using had. Like this is not being written in comparison, but to make a sense of yours, as the whole letter is not being written. Maybe we have a severe chest pain in today visit. I'm just summarizing this event. All of the investigations during ECG were normal, except exercise tonus test, which revealed some ischemic changes. So basically, if we can see that now we are even categorizing the mild chest pain history, we can write it down with the past perfect tense. And after that, after due to the, let's say, mild chest pain in the third visit, if you have conducted ECG of like it was normal, and however in the third visit you have some ischemic changes. So let's say after the patient reported to you on the third visit, we have conducted ECG. That's why we are using this ECG with the past simple tense. But if we had ECG in the second visit at the time we have this, or in the first visit, we have to use this the ECG finding with the past perfect, and same goes with the ischemic changes as well. Similarly, if we are writing the discharge letter, we can see the ward stay. We had written both of the things that had been done in the ward with the past perfect tense. Mr. James had uneventful stay in the ward, except he had blood transfusion, had. So then we can see the after the ward stay or at the end part of the ward stay, we are using with the past continuous tense. He was becoming gradually stable. Therefore, he was shifted in the same time frame to the rehabilitation, where the rehabilitation program has helped. Now I'm writing on the last day of the rehabilitation when the patient is going to be discharged, like in the recent past, recent present, can be used in the past perfect, or sorry, present perfect and present simple as well, right? So you can say if we have multiple, then we can. So we can see there that we have to write it down in this way. Like he was becoming gradually stable. He was shifted to the rehabilitation where the rehabilitation program has helped the patient to start walking. So I'm using in the present perfect. So transition can be seen. We am writing this what stay in the perfect tense. What the event that had happened, the what, the perfect tense. And now, after that, the patient was becoming stable. I'm changing the sentence in the near past because after this transfusion, after the ward management, the patient was becoming stable. So I'm using the past continuous and the past simple tense. And now, even when the patient was shifted to the rehab, it was also used in the past simple tense. I combined those things in one event, and the patient has improved, recovered to the wards management, and he's moving to the, let's say, he's being discharged now. So I'm using has with the last part of the rehabilitation when you're discharging the patient, right? So this is something summary form of your tenses to give you an overview to write it down which tense. So followed by the next slide, we can see there. Now the tense concept, if you are writing the today visit or the discharge plan, normally or ideally speaking, we can see there that the discharge plan or the today visit. Sorry, first we start with the today visit. Today visit, we should use mostly past simple or present perfect because they can be used interchangeably, past simple and present perfect. But normally we can use, let's say, today he presented or his condition has improved, very right in the today visit, right? So we can use these two tenses. He presented with same symptom along with blurry vision. His condition has improved. His condition has worsened. And we can also use the plan of referral letter with the passive voice, such as he has been transferred to the emergency department, right? Or DTN patch has been applied. We can use in the passive voice form, but with the thing has been done. So I'm using with this passive voice form of the ID. Okay. Followed by the discharge plan. In the discharge plan, normally we use the future tense, but with the modal verb, with the polite request. You should not use will with that because it will be harsh tone to maintain, right? Anyhow, she's vitally stable and is ready to be discharged. Now, this is our present tense. I would appreciate if you could ensure. Now, I'm talking about a future possibility or the request that we have to do. She will be discharged tomorrow if she's being discharged tomorrow, as she has recovered successfully. Her discharge medication includes, let's say, can be written in this way around. So, according to the sense of the case, we can select the tense that should be used in these letter, right? For today visit and for the discharge man. Followed by the fact, the present perfect tense, that is one of the most commonly used tense. So a general understanding, example, forget about the example. The main thing in the present perfect tense is for, since, and our. These are the examples that has been discussed for as well. But let's understand the for. When we have a period of time and there is no start of time being mentioned, we can use for that. Beside the example that has been written, it's a simple one. For make you understand this more appropriately, let's say, if I'm using this statement, she has, let's say, writing in past perfect tense, she had had physiotherapy for 4 months in 2012. So basically, you can see like in 2012, there are 12 months, which 4 months we don't know. When it started, we don't know in 2012. So that's why I'm using for. Or Mr. XYZ has had diabetes for the last 3 years. So we can use for that. And since we can use, let's say, when we do know exactly the start of time, period of time, right? So let's say 2009, let's say since morning, since yesterday, we can use since with that. Our can be used when we have the similar time marker that is being used to express a change in condition or to describe a repeated event. Let's say if the patient visited you multiple times, or patient has visited multiple doctor for the management of gout, let's say we can write down in 3 years, over a period of 3 years, Mr. XYZ, if he's still visiting, has had visited many doctor for the management of gout. So you can see we can use our when we have repetition, or if we have the worsening or maybe the improvement. Mr. XYZ condition has improved over 2 days, right? So we can use the since, for, or over. So for when there is no start of time being mentioned, since when we do exactly start of time, our is your to be used when we have, let's say, what I can say, the repetition, when we have the repetition of the event or the change in expression, right? Now, past perfect tense. Past perfect tense can be used. Past perfect tense can be used when we see it's an important tense when we have to differentiate. Okay, if we have to differentiate two things in past, let's say you can see this sentence. She had not been able to conceive over the previous 4 months, and as a result, she was suffering from depression. Right. So basically, there is two events that she's trying again and again, repetition of event actually, from 4 months, but she was not able to conceive. So we can just write down she had not been able to conceive over the 4 months, and as a result or consequently, she was suffering from depression. So depression, basically, first she was not able to conceive. That was the past, far past, and then she developed depression. That in the near past, right? So this is again can be used in the concept of reported speech. Let's say Mr. X reported that there had been blood in toilet bowl on 2 occasions. So it can be written in the reported speech to differentiate past perfect and past simple. So when we have the articles, now in the articles part, let's say we can use article a and the. The concept is if we have a countable noun and if it's let's say singular, okay. So it's a countable noun if it's singular, so we can use a with that. And if it's uncountable noun, let's say, and then we should use not any article for that, right? So, for example, there is some example for the countable noun such as if it's singular, lump is countable, abscess is countable. For example, complaint word is countable. Symptoms even at time is countable, such as fever is countable. We can move on toward the cough is countable because they all run in the bouts. So fever is also episodic, cough is also episodic. That's why they're countable, right? So as a matter of fact, you can see there, these are some of the rules and regulation that you have to follow. And familiarly for an, we can use that will give you a vowel sound with A, E, I, O, U sound actually, not with the word, but with the sound, right? Let's say an MRI, an X-ray, though they start with M or X, we can start like that, right? Then we can see that patient lives in a rented accommodation. Now these are example of uncountable noun. Moving on to the fact that you can say if we have the definite article, that we can use the with that when we have to mention something specific, such as mentioning the body part. Like if we have mentioned something first and you are mentioning it again, we can also use with the. So these are some of the example to be used for the definite article, because she has been suffering from diabetes for the last 2 years. She has been on the following medication. She has requested to bring the similar prescription with the word similar as well. We can use over here, right? So after that, we can see that we should not use any article. We basically uncountable noun that is not countable, or maybe the plural form, even such as disease is uncountable, any disease, right? For example, we have certain words such as the word pain itself is uncountable. The word surgery itself word is uncountable, right? Even there's a sample, let's say accommodation itself is uncountable, like advice itself is uncountable, right? So these are few things maybe that are uncountable. Assistance is uncountable. So anything that you cannot count, that is uncountable. Like we cannot say for pain even, until unless if you put the adjective before that. The word pain itself is uncountable. When we add a degree such as mild, moderate, severe, it's your uncountable noun, right? Mild, moderate, severe is your uncountable noun. Fine. So as a matter of fact, these are the example of countable and uncountable noun, right? Anyhow, after that, we can see we have the rules of capitalization. Now, in the rules of capitalization, first of all, if you have the medicine name, if it's name against any, let's say if it's a brand name, we can use the capital letter. And if it's a salt name, you can see that we have to write it down. You can say the lowercase. So in case it's a brand name, we use uppercase, and it's a salt name, we use the lowercase. Same is the case with the disease. If we have the disease, that's name against scientists, such as Parkinson, such as Bell's palsy. These are the disease that name against the scientists. We can use the capital letter. But diabetes, hypertension, bowel cancer, or blood pressure, let's say, these can be written in the lowercase. So the name of the institution, such as, or the hospital, can be written in the uppercase, right? Medical procedures should be in the lowercase. Body parts in the lowercase. Days such as Monday, Tuesday, Wednesday, uppercase. Months, uppercase. We can write it down, let's say, the special days such as Christmas, it should be in the uppercase, right? So these are some of the rules and regulation of capitalization. I hope you can remember. So followed by the point that is, you can say the next. Now, active and passive. As per your question, Dr. Fareed, result of depression, basically, if you can see that in in the past perfect continuous. So we can use in combination. We try to use in combination. Either we are using past perfect continuous in the previous laws. So we have to use the past continuous. It should be in combination. Past perfect continuous and past continuous, past perfect and past simple together. Okay. So these are some of the example that how can you transform the active and passive. The basic things that we assume that you already know the basics. We can move on to the personal perception to write active and passive wise. If we have to personalize the tone, like being a doctor, if I would write it down, I have advised him to see me again after 3 days. No, it's some the tone is personal. Impact is on the subjective information. But I want to show or highlight the patient perspective, we can just write down, let's say, or let's make it 3 sentences. Let's say I have advised him, let's say, paracetamol, right? I have advised the patient to take paracetamol, let's say. So, if you can change paracetamol has been advised, let's say, by me to the patient. Now, the third one is the patient has been advised patient has been advised paracetamol by me. Like, so these are 3 sentences, one active voice and 2 passive voice. In the first one, my tone, like it was important being a personal tone. I've advised him paracetamol and requested him to see me again after 3 days, right? And then we can see the next sentence is, let's say, paracetamol has been advised to him. Now here we can see that we are trying to impact on the medicine. Let's say paracetamol has been advised. However, it was not effective. Now we are targeting the impact of the medicine. And the next one is, let's say, the next sentence is your last one. We can write it down. He has been advised paracetamol. However, he remained non-compliant. So you can see, as per the importance of the information, when you see the case notes, if it has written paracetamol advice, RV 3 days. Like say it's your personal tone that you want to emphasize on the doctor. And if it's written, let's say paracetamol advice, no effect, then it means that you're targeting the medicine. And if it's written paracetamol advice, non-compliance, it's the tone toward the patient. So accordingly, you can use the active and passive voice. Then we have clauses in OET writing. Normally, we can see that when we have to make a contrast, we are using mostly, we can say, we are mostly using only but or however. It's not wrong, but you have to show the grammar expression. So we can use different different tools to use in clauses such as although, despite, despite the fact, even though, however, whereas, while. These are the different contrast clauses that can be used. Now we can use such as purpose clause that will also help you to emphasize that why this action was taken in the past or why a certain action need to be taken in the future. These are the linking words. In order to lose his weight, he was advised to modify his diet. Let's say, in order to lose his weight, he has been advised to lose his weight, for example, or he has been advised. Yeah, he is advised to lose his weight. Sorry, he is advised to modify his diet so that he can lose his weight. So it's in the future as well. So for the reason clause, it's also quite important, can be interchangeably used with the purpose clause, where it's the same concept of your purpose. So we can just write it down. Due to the fact he was overweight, he was advised to modify his lifestyle and so on. So it can be interchangeably used. So why? We can see the purpose and reason clause can be used interchangeably to show your grammar expression. And last part is the time clauses. We normally use at the time of admission, initially, firstly, at the time of discharge, while, whereas, and so on. Now, all these things can be used in a complex sentence. There are 2 phrases of complex sentence. The first one, although he has been taking painkiller, is your dependent clause. His pain is not settling, it's independent clause. So we can use any of the clause, either contrast, purpose, reason, and so on over here. Then we have conditional sentences. If you have any further queries, please do not hesitate to contact me. These are the conditional sentences, right? So you can see that these are different sentences can be used, complex, conditional sentences. And the last one are the conditional sentences, right? So this is just an overview of your grammar portion that we have discussed. So before we can proceed further, there will be a small quiz that I'm going. You can see this quiz. There was only one treatment that was done in the letter, that was ligament repair surgery. So this thing should be written in the introduction over here, right? So as per C, and the mistake you have used had with the history, that is also a mistake. You will be requiring your rehabilitation services, that is fine. So then we have the letter from the Mr. Mark, who had been playing basketball. These should be small. Basketball, it should be one word up till this, right? He did not play any game since. First of all, we use first form. Secondly, we cannot use did and since together. We can just use he has not played any game since 2005. And we have to rephrase this whole phrase, such as, sorry, he is a married man with 3 children. He's he's a married lab technician uh, living in a nuclear family in a 2-bedroom apartment, right? And she used to play basketball, but we cannot write down this thing over here. We have to write it down somewhere down the grade. Then you have not completed the rest of the things, right? So now we can move on to the letters. Some with your, you can see, we have to write it down. Let's say, we can say the surgery, ligament repair surgery, should be written in the introduction over here, right? Now we can see ligament repair surgery has to be written over here. So we just write it down, let's say, thank you for seeing Mr. Mark, who has undergone a successful married lab technician, uh, living with his family in 2-bedroom apartment. He used to be a basketball player, however, has not played any games since 2005. He presented from this line. Mr. Mark with presented to my clinic and reported that he had a fall, which resulted in knee twist, and presented with 5-day history of pain. Let's say, despite he was managed conservatively, he presented again after 2 weeks with worsening of his symptom along with swelling. Right? We can just write down this way. Investigation confirmed, let's segment here, and then he has undergone or undergone, or we write it down underwent. After surgery, his stay was uneventful. In view of the above, you are requested to pay home visit regarding his mobility as he would require session twice a day. Fine. This is your call. Thank you for seeing Mr. Mark, who had a fall yesterday and treated successfully. It's he, not she. We have to change it. You can see that you also have missed the ligament repair. You can write it down, the ligament repair, or who has a basketball player is wrong. He used to be a basketball player. However, we should relate it. He has not played any game since, not for, is grammatically wrong. He has not played any game since 2005, right? He's working as a lab technician. That is fine. He lives in a. So you can see there are small sentences. You can combine them together. Complaining is wrong. It's not complaining of, it's complaining of. But again, the sentence structure should be changed. He reported that he had a fall which resulted in knee twist and presented initially his 5-day history of pain, despite he being as he was overweight. So despite he was managed to lose his weight and despite he was managed conservatively, he presented again with the worsening of his symptom. So investigation confirmed ligament tear for which he has undergone, or he underwent also, right? Right. In view of the above, comma, if you could arrange, not can. Okay, that is fine. So then you can see the people who has sent me on the chat. You can see in the chat now. So we use she used to play, or however she has not been playing, has not had. Hmm? Okay, this is your Dr. Ibrar. Thank you for seeing Mr. Mark, who had been fallen yesterday. He was treated successfully. He would be advised. He would not be advised actually. We should write it down in this way, sir. Thank you for seeing Mr. Mark. We should write down the ligament repair over here. Thank you for seeing Mr. Mark, who has undergone a successful ligament repair surgery. Therefore, he needs the rehabilitation, right? The introduction part only should be written as that in this way. Has been basketball player since 2004, however. So he used to play a basketball player. We should not use has been basketball player because he stopped. So he used to be a basketball player in the yeah. He had been a basketball player. Better. He had been a basketball player. However, he has not played any game since. Right? Mr. Mark has 3 children. We can just write Mr. Mark, a married man with 3 children. Do not write two simple sentences or make it more composed. Mr. Mark, comma, a married lab technician with 3 children living in 2-bedroom apartment. Yeah, who lives in 2-bedroom apartment. So you can see these 3 lines can be written in just 1 or 2 lines. Then you can start from that. Though we should not write down this paragraph over here, we can write it down the grade because first to write an overview of the surgery. After that, we can see this paragraph, the same mistake. He has been complaining of right pain. We can start with this fact, Mr. जो भी नाम है patient का, Mr. whatever, reported that he had a fall which resulted in knee twist, and he presented initially with 5-day history of pain. Yeah, he presented on blah blah date, but if the date was given, the case not originally. Despite he was managed conservatively, he presented again with the worsening of symptom, right? He had presented, not had presented. It's recent past, so he presented again with worsening of symptom. Despite he had been managed conservatively, he presented again. So difference of time, we can use had been with conservative treatment and presented with the near past. Okay. So Dr. Hadika Haris Idris is your. Thank you for seeing Mr. Mark, who had a fall yesterday and was treated successfully. She would therefore require your possibilities. Or as you have not also written the post-discharge thing, rehabilitation actually, regarding the ligament repair, right? We should just write it down regarding the ligament repair in the introduction parts, Dr. Nikandris, right? You can just write it down in detail about the ligament repair, right? In the introduction. Thank you for seeing Mr. Mark, who has undergone a successful ligament repair surgery. Therefore, she required your post-rehabilitation services. Or we should write this paragraph at the end, and better to start. As I mentioned, Mr. Mark, married lab technician with 3 children living in 2-bedroom apartment. He used to be a basketball player, however, has not played in a game since 2005. Then we can start initially, not complaints of. We can just write down he had fall, resulted in knee twist, and he presented, or we can just write down he presented initially with 5 days history of pain. Prior to that, he had a fall, which resulted in knee twist. So despite being managed conservatively, he presented again with worsening of the symptom along with. Then we can move on. Investigation confirmed ligament tear, and he underwent. That is fine. His stay was, or we can just simply write down he has a successful ligament repair surgery. That is fine. In view of the above, you are requested to pay a home visit regarding his mobility as you would require. Okay, that is fine. Dr. Farid is sure. Thank you for seeing Mr. Mark, a lab technician. Yeah, that is also right. Who had a fall yesterday and was treated successfully with ligament repair. Right. So we can see there. You have picked this point in the letter. I appreciate that because that was the main thing that should be written. He would therefore require better to use. And then, sir, stop and start new sentence on the left side. On initial visit, put comma. Mr. Mark had a complaint of right knee pain for 5 days after a fall where he twisted his. That is fine. You pick it up. Consequently, an X-ray of knee was done, which turned out to be normal. Therefore, he was managed conservatively. Yeah, despite he was managed conservatively, he presented again with worsening of symptom. It should be summarized, sir, right? These two lines, along with swelling in the right knee. Investigation confirmed a ligament tear for which he underwent a successful ligament repair surgery. Perfectly fine, sir. Post-operatively, his stay and recovery was uneventful. Mr. Mark, yeah, is married man with 3 children, and he used to play basketball and played basketball for years since 2004 till perfect. And had played होगा इसको तो अगर change करें. Start new sentence from here. In view of the above, you are requested to pay a home visit regarding his. That's very well written, Dr. Farid name. Very well written, sir. I appreciate that. Hughes has not played any game since. Okay. Dr. Ardu Javed is yours. Thank you for seeing, let's say, Mr. Mark, a lab technician who had a successful has Dr. Arzu has a successful ligament repair surgery after he had a fall, right? It would be great appreciated if you could provide him. Perfect, ma'am. Initially, Mr. Mark presented with the complaint of pain in the right knee after he had a fall, which resulted in the twisting of his knee. Fine. Hence, an X-ray was done, which was unremarkable. Therefore, he was managed conservatively with painkiller and was advised to lose some pounds, considering the fact that he was overweight. Perfect. Mr. Mark reported the symptom become worsening, or however, he reported again with worsening of symptom, just like that. Okay, along with the swelling. On investigation, a ligament tear was confirmed. Therefore, ligament repair surgery was done and stay in the ward. Perfect. Please note that Mr. Mark is a married man who lived with his family in a 3-bedroom apartment. He used to be a basketball player, however, he had not played. That's fine, ma'am. In view of the above information, requested to pay. You have also written quite a good response. I really appreciate that. Okay. So now almost I think we have